Hi, this is Anna Crowe with the Get Real podcast, where CEOs, CMOs, and communications experts share their real advice. It's 6 questions under 9 minutes because we get to it real fast. So let's get to it. I'm thrilled to have today's guest with us. Could you please tell us who you are and what you do?
Hello, happy to be here. My name is Donna. I am the founder and CEO of the Global Liver Institute, which is the only patient-driven advocacy organization for liver health operating in the US and Europe.
I love that you guys are doing such remarkable work. So really excited to have you on today. What would you say, Donna, is the best thing about being a leader in your industry?
The best thing about being in this industry of healthcare and wellness, and certainly being at the helm of a patient advocacy organization, is that I know I have an impact every day. I could do other things. It's nice to know that and be confident of that. But I chose to be here. I chose to found this organization. And even if I've stepped out or away for periods of time to help other organizations, I know I have an impact in liver health. I know my presence and my voice and my lived experience matter. And it's, I'm wearing the necklace of one of the liver patients that we trained in our Advanced Advocacy Academy. And I know that I helped her, for other advocates who told me that not only changed how they do their advocacy, but who they are as people, to align, to get the privilege of aligning your professional expertise. I'm a lawyer by training, and your personal purpose, I think is just really a blessing. And I know that the things that I do every day make someone's life better. And in many cases, they would not be done if not for me and my team. Mm-hmm. And that's really an honor. That's really special.
Yeah, that certainly is special. And that's, like I said, such cool work you guys are doing. And the fact that you're, dedicating so much time and effort and helping others. And that really is a great segue to our next question, which is all around connections. Mm-hmm. I hear from other executives and leaders that creating authentic connections can be challenging, especially when there's a lot of noise out there. And I'd love to hear your take on that.
I think that particularly during this time of a global pandemic, in my case at least, the noise has actually lessened because I'm no longer running through an airport, traveling to this conference or this meeting or this health system. I'm here. I've been at home since March. We moved the team remotely very quickly. One of the advantages of being run by a person with an autoimmune disease is that we were prepared for a global pandemic in a myriad of ways. But I've been able to connect with our patients even more and more regularly through Zoom, and everything through Zoom. Although I've been on 3 different platforms today, I've been able to connect with my team in different ways. I have sort of open office hours where I just sort of open up a Zoom channel. Anybody who wants to drop in can come, and we've actually where I thought we would have to put our sort of plans for global expansion on the back burner this year, it really has opened up the world. One, because so many people are grounded. They're not doing the same running through airports that I was doing, and so we've been able to do programs, and I've been able to spend time with clinical and research leaders from Russia to Sweden to India, in ways and combinations of them, which has been the most fascinating thing, combinations of them all on the same call or webinar, in ways that, frankly, I wouldn't have been able to do if not for shutting out some of the noise and the travel and the movement and the activity. So it's actually been quite a unique and special time of connection.
That's awesome. And that's a great way of looking at it, because you're right. It's changed, but it's opened up so many other opportunities, and it's really how you react to it, right? And how you make that next effort to create authentically and genuinely with other people. And it's great to hear you're doing it with people from around the globe. A lot more accessibility for sure. Do you have any other real advice for other leaders? Is there anything else you think is important?
I think to be a good leader, you need to know yourself first. Whether that is so that you can build a team who's complementary to your own strengths and weaknesses. You need to know those strengths and weaknesses first. Certainly to lead in a time of great change, you need to know, your own triggers and your own energy, your own, what strengthens you, what nourishes you, and spend time on that so that you can bring, your best self to people, to be that rock, that anchor, that foundation, for people. So I think, spending time to understand yourself, personally, and certainly as a patient leading a patient advocacy organization or leading any type of organization, since I've led in the for-profit and nonprofit spheres, it's been really important to know myself, medically, when I'm energetically, the best. I think of Daniel Pink's When. So when is a good time to do work? Or I've been reading, Michael Hyatt's, books on, creating the ideal week. And certainly as a patient trying to optimize my health and energy time, I think those are lessons for any leader, even if they don't have a chronic illness or something they're struggling to. And then knowing yourself professionally, what are the things that really excite you? What are you really great at? And what are you not so great at? And at this point in my career, certainly leading with my strengths and hiring for the other parts is important. And being able to communicate that consistently when people are, particularly when you're adding new people to the team who haven't worked with you before, to help them navigate and be successful within your organization. So, as Aristotle said, know thyself.
I love that. And you're so right. Self-awareness is critical, and just putting it all together, really understanding yourself personally, professionally. And I love the books you mentioned. So thanks for plugging those. All right, we've got time for one more question. So obviously you've had a pretty successful career, but there's always a place where one gets started. Can you tell us about your first job?
Well, I think for people who know me, it should come as no surprise, perhaps, that I started as a personal shopper at Macy's in Connecticut, right on the border of New York. And so that sense of creativity and service to others translates in many other jobs. And certainly I use the conference arena to showcase that particular skill and passion. And I look forward to doing that again someday when the world reopens.
Nice. Very cool experience. All right. So how can people get a hold of you or learn more about what you're doing?
Absolutely. I would love that. And thank you for that opportunity. We are globalliver.org, global like the world, liver like the organ, .org. I'm also on LinkedIn and Instagram and Twitter. Personally, I'm DC patient. I live in Washington, D.C. I'm a patient. My name is Donna Crowe. It's a little pun. So I'm known on Twitter often as DC patient, but globalliver.org is the place to find all of the resources that we bring to the table.
Awesome. Well, appreciate you being on today. And thanks everyone for tuning in. This is Anna Crowe. For more insights, visit us at crowepr.com. Thanks so much and make it a great day.
Thank you.